The state of Michigan is working to improve care and services to those with sickle cell disease. About 4,000 Michiganders live with the painful genetic blood disorder. The state health department has announced a new strategic plan to better help those people, including reducing barriers for care. I spoke with someone from the department about why this is so important. Blood shaped like a crescent, causing blocked blood flow, pain, serious infections, stroke, and organ damage. That's the reality for 100,000 people in the United States with sickle cell disease.
One of the most prevalent blood disorders in the United States and throughout the world. It impacts about 4,000 Michigan residents.
Michigan's Department of Health and Human Services is announcing a new strategic plan to raise awareness, expand access to care, and strengthen public health surveillance surrounding the disease.
Historically, there have not been a lot of medications available to treat this population, but recently there are some newer disease-modifying medications on the market. Particularly cell and gene therapy.
Sickle cell disease primarily affects African Americans. Patients face barriers in care, especially transitioning from pediatric to adult care.
There are not a lot of providers in the state who treat patients with sickle cell disease, and so as they age, they tend to find themselves spending a lot of time in the ER managing their symptoms.
When creating the state's plan, patient experience heavily influenced the final draft.
They talked about even when I'm feeling my worst, I have to present like I'm okay when I'm really not okay, because I don't want to be labeled as drug seeking.
Some of the goals in the plan include providing increased education about sickle cell disease, ensuring access to high-quality treatment, and creating system changes to center the needs of the sickle cell community through collaboration.
Continues to be barriers and disparities that this particular population continues to experience. The department has taken a step forward as one of the first in the nation to really try to focus on this and improve.
You can learn more about all of the goals of the state's plan on our website, 13onyourside.com.